I'm Katie Larsen, General Manager of Diversity, Inclusion and Participation at Mind Australia, and we're here to talk a bit today about the final report from the Royal Commission and some of the recommendations that have come out of that, and particularly how that looks from a lived experience and peer work perspective. I'm here with Bianca Childs, who's our Senior Lived Experience Advisor at Mind.
Yeah, I'm really excited about the findings of the report, in particular the recommendations for lived experience throughout the mental health sector, including peer support roles, but also lived experience at all levels of decision making and all levels of organisations and services.
Absolutely. I think the articulation of around decision making and it being woven through all of the components of the recommendations was really exciting. It wasn't sort of sitting in one section of the report. It was really clear that it was integral to whole of system reform, that we're focused on lived experience perspectives. One of the aspects that I was really excited to see was around peer-led or lived experience-led service models. What do you think it will take for that to be really successful across the reform that is proposed?
Yeah, I think the idea is great. I'm really hoping that there are enough of these peer-led services throughout the state so that people can access them, have a choice between accessing a traditional service or a peer-led service wherever they're located, but also at whatever stage they are in their recovery. So, if somebody's starting to get unwell, they can go to a peer-led service as opposed to going to a GP or as opposed to going to an emergency department. If somebody needs an overnight stay or accommodation, they can go to a peer-led service or an inpatient unit, and the same with outreach, they can have that choice.
I think it was interesting to see how lived experience roles were discussed, and really the need for legitimacy around lived experience roles in terms of how they're understood in a professional context. And I was pleased to see that there were discussions there around stigma and discrimination, and that you actually really need to address stigma and discrimination firstly to make that successful, but also look at professional support and ensure that when you're developing lived experience roles and lived experience contributions, you're recognising the discipline element of that work.
Yeah, I agree. We've just launched our peer work framework at Mind, and that describes peer work as a discipline, the model of peer work, so what it looks like in practice for our peer workers at Mind, working in Mind services, and how the roles are different to non-peer roles. It also talks about all of the ways that we support our peer workforce at Mind, from training and peer supervision to also training for managers and teams around working with peer practitioners and understanding and recognising the value of lived experience. It's great with the Royal Commission that they're saying that, but Mind's been employing many organisations within the community sector have been employing peer workers for 10 or 15 years because we're seeing value in what they're bringing.
Absolutely. I mean, we have about 100 lived experience roles, which includes majority peer workers, but also other designated lived experience roles. And last year we saw a need, as we were developing the peer work framework, to actually develop an overarching piece of work that addressed the whole of organisation needs. So this year we'll be launching our lived experience strategy, which will look at lived experience from decision making to innovation to workforce, and all of the components that you really need to ensure a really safe, inclusive and accessible environment for lived experience workforces, but also more broadly for people who come and work in the sector that might have a lived experience. We know about 52% of our staff have a lived experience, so it's about the whole picture of what that means. And I think a final comment on the report is just how promising it is to see the voices and the perspectives of consumers and carers and families really rise through in this report. We know that a lot of what's been said has been said for a long time, but maybe it hasn't been represented in paper and in reform process like it has with this report. So we're really excited to work with the recommendations and really continue to drive our work forward to make this as successful and most importantly to change the system for the better for the people who most need it.
Yeah, definitely.